So hi guys, so today we'll be discussing a new treatment that we're really excited about, and that will be our fractional laser skin rejuvenation. So if you want to see more, keep on watching. Talking about our photon laser, we now have a new treatment which is fractional laser skin rejuvenation. So this treatment is excellent because it can go through the skin, target water, collagen, fat, and it can help to rejuvenate the skin. Now, you know, back in the 90s, the CO2 laser came out, which is something that's really aggressive. When it came out, it was very exciting because it can pretty much blast off the top layer of your skin. But that's also its limitation because it's so aggressive, there's a lot of downtime. So fractional laser came out, there's Urban, there's Yak, there's different ones which sort of target the skin a little bit differently. It's not as aggressive as CO2. These also have the limitation of downtime. So later on, they looked at all the different nanometers in terms of what light hits, light energy. They found that 1470 is a very good one. 1470 can target, as I said, water, fat, collagen. It can help stimulate. So what this laser will do, it will follow some pixels and it will sort of make burrows into the skin, 200 microns, which is very small. And it will go, let's say we go over an area of about a square centimeter, about 30% of that will have thermal injury. So that thermal injury, since it's only about 30%, you have normal tissue in between that will not be damaged or hit by the laser. So what that will do is, think of yourself getting little tiny injuries all over the skin with a laser precision, and your body will now see that injury and come and want to heal it. So now it will stimulate collagen and tightening. It will take care of surface texture. It can take care of acne scars. It can take care of surface wrinkles. It'll also hit dark spots and lighten those up as well. So it will be a treatment that's an all-in-one, which we think is really, really exciting. An all-in-one treatment to just get your skin brighter and tighter. So hearing all of that, you have any questions so far?
Sure. What is the downtime after for this?
Okay, on average 72 hours. But I mean, if someone has very sensitive skin, it could be up to 7 to 10 days. But that would be, the downtime is mostly a bit of redness. So it depends on the treatment. So I'll show you here on the machine. So if we go to treatments, we go to fractional here. And we do go ahead and skin rejuvenation. We have different levels. So that's the amount of energy. So for example, if we go for level 1, you can see that that's about 2.2 watts. Okay? While if you go, for example, to a level 3, you might find that it's 4.2 watts. That's a lot more energy. So the downtime also depends on which area you're targeting and how much energy that you apply to the tissue. However, the more energy, the more immediately you'll get a result. While you might need 1 or 2 treatments of more energy, like at 4 watts, if you go with, let's say, 2.2, 2.5 watts, you might need 3 treatments. But however, it will be less downtime, so it's just a matter of how aggressive you want to be. For example, I think you're off this week.
I am.
So we're going to discuss and see, looking at your skin texture, very beautiful skin texture. I believe you can handle a bit of energy. However, the things we look at, for example, is hyperpigmentation, and we of course discuss the risks and benefits of everything. We talked about the benefits. We want that tight and bright skin, but of course, it's injury to the skin. So anyway, there's injury, there's a risk of possibly some heat, some pain, some scarring. If you've seen those old pictures of the CO2 laser, it wasn't pretty. So it's not going to be anywhere as near as that. It's going to be small areas of injury with normal skin in between. So it almost look like when you've had microneedling, you see how you have those needles that cause, it almost looked like that. But the laser is the one causing the pixels. I'll go back and show you, for example, if we custom it, and then I say we want to go into the Lightscan cadence. Look here at the pixels that are formed here. If you zoom in, you can see this is the pattern here. So let's say we have this grid of 100. You can see that each of those will fire. So only 30% of it will be injured. We can up it. You can go and have some more spots. You can change the fluence, you can change the energy and all of those things, so we can custom it. So we'll start off with a little spot, a treatment to make sure your skin reacts well to it, and then we'll go on and have a full treatment. How's that sound? Treat right here so you can see what it feels like. And if you look, you can see that we'll make a pattern, the pattern we talked about.
Okay.
All right, so we're looking to see everything off. Looks fine. Okay, how was that?
That was probably 1% of what it feels like when you get a Botox shot.
Oh, okay. So we're gonna start a cleansing. We've had some numbing medicine on the face. So when you come in, we'll numb you for 20, 30 minutes to make sure you can tolerate it. All right. All right, so let's go ahead and get started. All right. How are you feeling, Lucy?
Okay.
Yes. So that's the laser light. You can actually see it going over a beautiful pattern penetrating the skin. Then come and zoom in. Beautiful. So lasers become a little more advanced as time goes by. You don't have to be ablative and take off the whole layer of skin of the laser. So now you can see we're preserving some areas. You can see where the pattern is hitting it. That's hitting it and leaving some normal skin in between. The good thing is your own body will heal and tighten up and form new collagen. Beautiful. Put your lips together if you don't mind. Okay, now hopefully you can manage this, okay? Around the mouth is always bad. You okay?
Mm-hmm.
All right. Okay, perioral lines are always challenging, but this is a great way to hit it to place the energy to tighten around here. There, you're almost there. It's a little spicy. Get in there. Yes, you are better than me. Okay. Right? We don't go below the higher bone.
Mm-hmm.
How's your neck doing?
It's a little spicier than my face was.
Did we actually numb you there?
She did, but I don't think parts
down here.
Right.
Because that's true. We usually don't go past here, but I go down the side and not past here. But okay.
But it's okay.
Ooh. You're a brave one.
It's alright.
Okay.
I would take this over microneedling any day.
Wow, that's amazing. And some people who had both, they're like, well. But my last lady had it last week, and she's like, come back. She's like, I'll be back and give me level 3. Because I sometimes do 1 or 2 just in case. Your first time getting laser. How's that feel? Might be a little more spicy.
It's a little bit, but it still isn't even
Tolerable.
like that one felt like a injection.
Okay. Some of them will feel a little stingy because you're a little more power here. But this is good if you just want an all-in-one modality and you don't know what you need, like you have some pores, you have some little bit of laxity. That's a good all-in-one place to start. Well, and you also pre-treated the area, which was good. So we like to give a pre-treatment and post-treatment with once you work with laser energy. So you can see a little redness forming. What do you want to see? Wonderful. Okay. The thing is, after the age of 25, we lose like over 5% of our collagen a year. And it's gone forever unless we do something to regenerate it. Only a few things do that. Like laser treatments, microneedling does it. Certain radio frequencies can do it. certain LEDs. So you're just going to keep losing unless you know, make a regimen to maintain things. You can see the neck is less energy, right, Sid? You can take a look. I mean, don't get too scared.
It's not so bad.
All right, so that's what you can expect
Okay.
post-treatment with this sort of fractional laser. It does cause some thermal damage. You can see that your skin is a little red. We want to see that. We want to see that the energy is reacted of your skin, and that is when you have a good result. You don't want to come in and have nothing happen. So I'm going to add a little bit of stem cells to your face now,
Okay.
while it's a little bit red, and that these stem cells will help to regenerate even quickly and help to heal those areas.
And what should I put on after?
All right, so you have a post-treatment serum that we'll be giving you. This one will have some peptides and some collagen and some vitamins to help heal your skin. We'll also be giving you a shot in your arm of amino acids before you leave.
Okay.
And these stem cells treatments, you'll apply it every day, twice a day to your skin, so it will heal. So as expected, the post-care, you might see this redness will last maybe for, I would say, up to 72 hours. Expect to see some redness on your skin. You might feel, I doubt you'll get crusting. When we go very deep and aggressive, you might see little areas, like little tiny areas of crusting. I don't expect to see that on you. And then, so you don't look great for the first 3 days, but you continue to improve after. And then usually by several weeks afterwards, you'll see a great improvement in your skin texture as it heals. All right, the important thing is sunscreen. We want you to avoid the sun and have sunscreen because thermal damage can really cause you to have hyperpigmentation, which is what we want to avoid. Okay. Any questions?
No.
All
I
right.
think I've got it. Thank
Well,
you.
we'll have you back and do the follow-up so we can show those beautiful results.
Okay.